Exciting, eh? Pinprick light touch. Easy, eh? Just with a paperclip. In absence of any neurological, expensive thing to do the neurological assessment. And then what you need is to have this sheet, the ACER score sheet, to find out where the key sensory points are. And on the back is nice, and you have some explanation. And there it also says that we talked about it's impossible to determine the motor level in the trunk. And here it basically says that we could assume that the sensory level equals the motor level in the trunk. So if sensory level is absent, then you could assume that motor function is absent as well. That's basically what it says. You could argue about this as well, by the way, but this is convenience. So we start at a C2 level, but that's like hardly done because I've never seen anyone with at least alive with a C2 complete spinal cord injury. I've never seen one, never ever. The highest one I've seen is a C3, which is like not a nice situation, of course. That is. So we start with C3, and what I do is like the light touch in a pinprick, and you can easily do it all in one. But you have to instruct your patient carefully. So what I'm going to do is make sure that you find a spot where you're pretty sure that feeling is normal. Yeah? So I'm going to do an assessment on how good you are able to feel things from external. So can I show that on your, I will do it here on your face, yeah, at least you can feel. This is the light touch. Can you feel this? This is the pinprick. Yeah? Do you feel the difference between those two? Between this one and this one? Yeah. So what is this?
It's more like a stroke.
Yeah. So the light touch in this case is more. Now, of course, we're going to do that with eyes closed. So we do it once again. Just first the difference.
Yeah.
Yeah. What is this?
Light touch.
Okay. Then I'm at least clear. For me, it's clear that the patient knows what I'm going to do. Now you can do two things. First, go over the pinprick, all, and then a light touch. I won't do it. We just do pinprick, light touch, and then basically it says it's absent, so she doesn't feel anything at all. Or it's impaired, so it could also be different than you expect it to be. So then you have to tell me. If you can perfectly feel it, then you say just pinprick or light touch, and then we score 2. Yeah. So normal according to what I scored. So then we start with the C3 levels, which is besides both claviculas. Yeah. So I will start first with the right side. Eyes closed.
Yeah.
What is it?
Light touch. Pinprick.
Normal?
Yeah.
So scores 2. That is C3.
Does the patient know normal?
The normal is according to what I showed her on her face.
Yeah.
Yeah, so that should be identical. And normally if a patient says yeah, light touch or pinprick, then you can be pretty sure that it's okay. A patient won't cheat you because that is not like in her and in her interest. So should be honest about it. But again,
Is that above or below?
no, it's here.
Oh,
Beside both clavicula. And here you can see it there. And it's like here, this indicates the clavicula.
Okay.
So I will do it above the clavicula. So then we continue to C4, which is more according to the acromion. So the same idea. There it goes.
Light touch. Pinprick.
2, 2. Then you go to C5, which is you have to put the hand in the palmar position like this. So C5 is then here just above the elbow. So then we do.
Light touch. Pinprick.
Okay. Yeah. And then we go to C6. And I have to sometimes to have a look at it as well. a C6 layer. That is on the dorsal side of the thumb. So then, like, if you look at the hand, then it's divided in C6, middle finger C7, and the two little fingers in C8. And then this will be T1. All right. So that's what we'll do. So we go here. Let's see. Yeah, it's on the finger itself. So that's what we'll do. So it will be here. There it goes again.
Light touch. Pinprick. Light touch. Pinprick.
I have to be careful with what I'm doing right now to put my hand here as well. It might
that
cause some
like this?
extinction.
Disrupt. Yeah.
Yeah,
Okay.
yeah. So that's what I realized right now. So I shouldn't do that.
Light touch. Pinprick.
Okay.
Light touch. Pinprick.
And so on. This is just for the arm. Otherwise we
You
have to.
don't do T2?
Yeah. We can go on for every
Yeah,
level here,
okay.
but for
No,
now
I
it's
thought
just
it's for the arm. It's part of the.
yes, part of the
Oh.
arm. Yeah, not yeah.
Kind
yeah,
of.
Yeah, kind of. Now we can do that T2, but that's somewhere here. So we should do it here then.
And
Yeah.
Light touch. So we have access now from C3 up to